Hi, I'm Kim Borchert with Austin Doula Care, and I want to talk to you a little bit today about optimal fetal positioning. Now, a lot of you might be curious what that is. I know I was the first time I heard it. And it has to do with the way your baby is sitting in your pelvis. Your provider might be telling you your baby is head down or your baby is breech. But what your provider's not going to tell you is where your baby is in your pelvis. So we've got a couple of different positions that your baby can be in. The ones that we commonly think about, besides breech or vertex. Posterior, where your baby is sunny side up looking out at the world. Or anterior, your baby's face is looking at your back. This is the ideal position for giving birth. And this is because the baby's head has these great little places back here called the fontanelles, or the soft spots, that cause the baby's scalp as they're coming down into your pelvis to kind of close in on itself so that baby can fit through the pelvis a lot easier. When your baby is anterior, they can tuck their little chin like this, and this smallest part of their head is what's going to come out of the pelvis, come out through the pelvis. If your baby is posterior, this is the largest part of their head, and this is what's going to be presenting, because when they're posterior, they can't tuck their chins. So they're coming down, and the front of their little faces are going to hit against your pubic bone here, the pubic arch, and it's a lot harder to push this baby out. So, what do we do to help optimize your baby's position? There are some really simple exercises that you can do every day in your third trimester to help your pelvis and your uterus have room for baby to find the right position. This is called the 3 Sisters of Balance from Spinning Babies. And I'm going to show you those now with the help of my good friend and president of CTDA, Sarah Parente. She was my doula, by the way. All right, so the first one we're going to do is the inversion. We're going to show you 2 different variations of the inversion. When you do this, you're going to come on your knees to the edge of the couch. Make sure you have somebody with you the first couple of times you do this to make sure you feel good about it. And then you're going to go down, hand, hand, elbow, elbow. And you see how she's got a nice steep inversion from her pelvis all the way down to the crown of her head, and she's relaxing her head. That's what you want to do. You're going to do this for 3 breaths in and out. Once you hit those 3 breaths in and out, you're going to come back up onto your hands and back up on the couch. And it's really important to come straight up, straight up, straight up when you do that, and those 3 deep breaths in and out. Now, Kim, I'm super, super pregnant and I can't come back up on the couch. What do? You are going to come up onto your hands and you're going to crawl out. And you're going to do the same thing, deep breaths in and out. What this does is this is going to stretch your uterus. Your uterus is a muscle, and like any other muscle in your body, it can get tension and knots and all sorts of things. This is going to stretch your uterus. This is also going to get your baby out of your pelvis a little bit. So if they're in there kind of a little wonky, their little head is tilted, they're going to get out of there, be able to wiggle their little head around, and then go back into a good position. Another option, if your couch is too steep or you just don't feel comfortable going all the way down to the floor, you can use yoga blocks to put your elbows on, and that helps as well. So that's the inversion. You do that every day. 3 deep breaths in and out down, 3 deep breaths in and out up. The next exercise we're going to do is the belly sifting. For this, you're going to want to have an exercise ball. Some people call it the birth ball. Or if you don't have access to one, you can always lean on your couch or on another low-lying surface. This is a rebozo. And I'm going to put this around Sarah's middle here. This is going to go from the top of your fundus all the way to the bottom of your uterus. Okay. So partners, when you're doing this, you're going to want to make sure your knees are positioned so that you could squeeze your partner's hips. You could squeeze the birthing person's hips if you wanted to. That's going to help make sure that you've got a good position. And then you're going to lift up. Every partner asks me, how much pressure should I lift up? The birthing person will tell you. And then you're gonna make really small circles. And this feels really good, especially on a pregnant person, because they are carrying so much weight in their middle that this is just taking that pressure off. Now, while you are doing this, you should make sure that the person who's doing the rebozo, that their arms are at a 90-degree angle, kind of like mine are, and that your shoulders are lifted up and back. When you're done, you slowly release. If you release quickly, it will hurt your person. You don't want to do that. Okay, so that one is 5 minutes every day. I call that one the partner exercise. And then our last one is the sideline release. This one is can be a little bit tricky. You want to do this on your bed, or if you're short enough and your couch is high enough, you can do it on the couch. You know that you are in the right position if your pregnant belly is hanging off the bed or the couch, if you're in your 3rd trimester. You can do this before your 3rd trimester, absolutely, but really what you're looking for are your hips to be at the edge. So you're going to make sure that the pregnant person's back, or hips and shoulders are stacked, and your hand, the palm of your hand, is going to come right here at that hip joint to support them. And then you're going to ask the birthing person to drop that top leg off of the bed. And now you can give it a little jiggle, because the body does not give consent as quickly as the mind does. And then you just wait and you watch for that foot to drop. Now, because my couch is pretty short, Sarah's foot has already touched the floor. But this can happen quickly for some people, or it can take a couple of minutes. Just be patient and watch that foot, because it will slowly release as tension releases from the pelvic floor. And because we need to have balance in all things, we have to do the other side. Even to Sarah, who's not pregnant, because this is still benefiting her pelvic floor. Ready? And there we go. So I hope this helps a little bit, gives you some ideas, some tips, some ways to think about how to move your body, some exercises you can do. A couple of other things to consider. Imagine you have a flashlight on your belly button and it's always pointing forward or down. The heaviest part of the baby is their back. So if you are leaning backwards, so is your baby, and that's a posterior baby. If you are forward leaning, your baby is going to be forward leaning as well. Just keep that in mind in the ways that you sit and the ways that you move your body. Be mindful and have a wonderful rest of your pregnancy and birth.